Right now, inside each of us, there's this silent battle going on. It's a constant fight to keep everything in balance in this unbelievably complex system we call a body. But when that balance gets thrown off, well, that's when knowledge, real connected knowledge, becomes the most powerful weapon we have. And that's exactly what we're going to dive into today. It's a huge question, isn't it? But the answer, it's not always about those big, dramatic moments you see on TV. A lot of the time, it's about understanding the story the body is trying to tell you through its symptoms, knowing the science behind what's gone wrong, and then choosing precisely the right tool to help rewrite the ending. So to really get this, we first have to appreciate the incredible tightrope act our bodies are performing every single second. We're going to take a look at what happens when that balance is totally shattered. And this right here is the absolute key. This isn't just about memorizing a bunch of facts from a textbook. We're following the threads that connect pathophysiology, which is basically the study of what's going wrong in the body, with pharmacology, the science of how drugs can help fix it. That connection, that's the foundation of evidence-based practice, and it's how a nurse uses all this knowledge to make literal life or death decisions. Okay, so our first scene opens with a total crisis, an acute coronary syndrome. Every single decision, every medication given is a race against a ticking clock. The body is sending out a major distress signal, and someone has to answer the call. So what is actually happening in this moment? Well, inside one of those critical arteries that's feeding the heart, a buildup of plaque just ruptures. This triggers the body's emergency clotting system, and boom, a blockage forms. Just like that, the heart cells downstream are being starved of oxygen, and they start to die. The damage begins in minutes. Now, what's so interesting here is how the body screams for help. You've got the classic signs, right? That crushing chest pain, a feeling like something terrible is about to happen. But look closer. For women, the signs can be way more subtle. Maybe it feels like indigestion, or just extreme fatigue, or being short of breath. Recognizing these kinds of population-specific differences is an absolutely critical first step in assessment, making sure you're giving the right care to the right patient. And this is just a beautiful illustration of that immediate life-saving response. It's not one thing, it's a multi-pronged attack. You give oxygen to feed that starving heart muscle. You give aspirin to stop that clot from getting any bigger. You give nitrates to open up the blood vessels, which takes some of the workload off the heart. Then beta blockers to slow the heart down so it doesn't need as much oxygen. And finally, ACE inhibitors, which have been proven to lower the risk of death in those first 24 hours. See, every single drug has a very specific job to do, all based on the science of what's going wrong. All right, let's move to our next case and see how this all builds. We're shifting from the heart to the brain. It's another code red situation, but this time there's a whole new layer of complexity. Here, the very first decision you make is the most important one. Okay, I know this looks really intimidating, but I want you to just think of it like a chain of dominoes. When there's an injury, this whole cascade gets triggered, one domino knocking over the next, and the end result is a clot. Now, different anticoagulant drugs, you might have heard of some, like heparin or Xarelto, they're all designed to block a specific domino in this chain. Understanding this map lets a clinician choose exactly the right drug to stop the process cold. And this is why understanding that domino effect is so critical. A stroke isn't just one thing. It could be from a clot blocking an artery, that's an ischemic stroke. Or it could be from a blood vessel bursting, a hemorrhagic stroke. The symptoms can look almost identical, but the treatments are polar opposites. If you give a powerful clot-busting drug to someone who's having a bleed, well, the results would be absolutely catastrophic. That initial assessment and diagnosis is everything. And sometimes the body sends a little warning shot first. It's called a TIA, or a mini stroke. It's basically a temporary blockage, and the symptoms go away. But it is a massive red flag. Why? Because for up to a third of people who have one, a major stroke is right around the corner. This is a huge opportunity for a nurse to step in with some really effective patient education to help prevent that from ever happening. So far, we've been looking at these acute, time-is-everything crises. But what about the long game? The kind of chronic battle that unfolds over months or even years? Let's shift our focus to cancer, which is a completely different kind of challenge. Yeah, we used to think of cancer as just uncontrolled growth, but we now know it is so much more complex. This wheel shows what are called the hallmarks of cancer, and I want you to think of these as a set of superpowers that a normal cell has to learn to become truly cancerous. It has to figure out how to resist dying, how to hide from the immune system, how to grow its own blood supply. It has to master all of these things. This table here makes the distinction crystal clear. On one side, you've got benign cells. They grow slow, they stay put, and they pretty much look like normal cells. But on the other side, you've got malignant cells, and they are the exact opposite. They grow fast, they invade their neighbors, and they can metastasize or spread to totally different parts of the body. That right there is the fundamental difference that defines cancer.
So how does a normal cell even go rogue like this? Well, it all starts with damaged DNA. Risk factors we all know about, like smoking or too much sun, can cause those first mutations. Then other things can promote the growth of these damaged cells, until eventually you have a full-blown tumor. And this is where health promotion and teaching is so important, because preventing that initial damage in the first place is always the best defense.
Okay, so we've looked at a heart attack, a stroke, and the fundamentals of cancer. 3 really different scenarios. But running underneath all of them is a single powerful way of thinking. Let's bring it all together. Just think about it for a second. That rapid-fire response to the heart attack, the careful diagnostic puzzle of the stroke, the long-term planning for cancer care, those aren't just random actions. They all follow the exact same systematic approach. It's a continuous loop of observing, understanding, acting, and then reevaluating. And this whole process actually has a name. It's called the nursing process. First, you assess. You gather all the data, the symptoms, the history. Then you plan. What's our goal here? And what's the evidence-based way to get there? Then you implement the plan. You give the meds, provide the care, and then crucially, you evaluate. Did it work? Are things getting better? Do we need to change the plan? This cycle is really the heart of safe, effective patient care. So what does it take to save a life? It takes connecting the dots. It's the science of understanding why the body is failing and knowing how a specific treatment can intervene. It's a constant process of critical thinking. And when you see this incredible dance between disease and treatment, does it make you think any differently about the amazing, complex machine that you're living in right this second?